As far as who influenced me to become an orthopedic surgeon, I would say it's probably a combination of family. So my mom is in medicine, nursing primarily, my dad's in engineering, and so we like to joke that they kind of put those two things together and you spit out an orthopedic surgeon, give or take. And then as far as what, I played a lot of team sports growing up, and when you play a team sport, you really learn to recognize all the nuances of everything that people bring to the team. And so orthopedics was definitely something that I noticed that in my rotations in medical school and kind of beyond, and it's been a really big part of, one, why I went into it, and two, why I stayed. So my role at RAMC is primarily an orthopedic surgeon with a focus on upper extremity surgery. So I work on the clavicle all the way on down to the fingertips, and so that's arthritis, that's fracture care, that's nerve and tendon care, soft tissue rearrangements. And the cool part about that is hand surgery is a little bit unique in that the timeline from surgery to back to your life is very, very short. So people talk about surgeries taking, you have a 6-month recovery. There are plenty of surgeries that are in hand surgery that it takes 3 days, and you're back to your life, you're back to your job, you're back to your routine, and you can kind of get back to your family and everything that is undoubtedly important in your life, which is kind of unique and really great. There's this common kind of saying that you treat orthopedic surgeons like a carpenter or a mechanic. But I had a mentor who framed it a little bit differently, and I've kind of taken that with me throughout the rest of my career, and he likens us more to farmers. So we put things in the right area, we give them the right environment, and then we watch them grow. And that's probably my part of orthopedics that I enjoy the most, because really, I'm not the miracle worker, I'm just the farmer. I put stuff in the right position, and then we watch biology do the rest, and the people do the rest as well. So that's been really satisfying. I chose RAMC because, for a couple different reasons. One, the small town thing has always been near and dear to my heart. I grew up in a small town in Wisconsin. My husband grew up in a small town in Wisconsin. My family's still here, his family's still here. We want to stay around. And then the Driftless region, Reedsburg in particular, and this really community-based, community-invested hospital is really, really appealing, and something that I have learned very much to appreciate. It's easy to see how invested everybody is in the success, one of the patients and two of their coworkers. It's very palpable, very noticeable, and distinctly excellent. So I guess like your stereotypical orthopedic surgeon, anything outside, active. I got my husband into cycling, and since then he's kind of been dragging me out onto the bike every chance he can get. Anything on the water. I grew up on Mendota, Monona, Kegonsa, Wabeesa chain of lakes. Love spending time out there, either on the boat or kayak or paddleboard or anything like that. And then my token weird fun fact that everybody loves to talk about is curling. I grew up curling, like the winter sport with the rocks and the sweeping. And I'm always happy to talk about it. I will happily bring it up given any opportunity. But I grew up doing it. I started being competitive with it when I was 13 years old. It kind of carried me through college. I went to Worlds a couple times, the Olympic trials a couple times. It was really great. It gave me the opportunity to see a lot of Scandinavia and Europe in the winter, but still very cool. And is something that I miss a little bit and I'm excited to get back into.